let's continue our discussion. So again, let's talk about the transversus abdominis. So it is also a thin sheet of muscle that lies deep to the internal oblique. So it runs, or its fibers run horizontally forward. So as you can see, the yellow lines here are actually um, trying to describe or trying to make you see the fibers of the transversus abdominis. So these lines are actually horizontal, okay, obviously. So they originate from the lower six costal cartilages, lumbar fascia at the back here, the iliac crest here, and then also the lateral third of the inguinal ligament. So again, take note that your internal oblique, on the other hand, originates at the lateral two-thirds, and then your transversus abdominis originates at the lateral third only of your inguinal ligament. Now it inserts into the xiphoid process above here through your yes, xiphoid process, and then the linea alba at the center of the abdomen, and of course your symphysis pubis right here. So here is another table for your transversus abdominis. So the nerve supply, of course, includes what also supplies the muscles for your external and your internal oblique. On the other hand, its action is somewhat different. It just compresses the abdominal contents. Take note of that. Next, we have here on the left is your rectus abdominis. So as you can see, it is a long strap muscle, again, long strap muscle that extends along the whole length of the anterior abdominal wall. So as you can see, it is broader above and lies close to the midline. So this is your midline. So it is actually, or so the, sorry, so the left and the right rectus abdominis are separated from its fellow, from each other, by your linea alba. So this is your linea alba. So the rectus abdominis originates at the symphysis pubis and the pubic crest. So as you can see here, symphysis pubis and the pubic crest right here. Now they insert at the fifth, sixth, and seventh costal cartilages, and of course your xiphoid process. Now we have here another table. So your rectus abdominis are supplied by the lower six thoracic nerves, and its action includes compression of the abdominal contents and flexion of the vertebral column, or flexion of the trunk, and they may serve as an accessory muscle for expiration, especially during forced expiration, if you can remember that. Okay, let's go back again to the picture. Next, we have here our pyramidalis. Again, this is your pyramidalis. So it is a small muscle that lies in front of the lower part of your rectus abdominis. Then, sometimes, however, it is often absent. So it originates from the anterior surface of the pubis right here and inserts in the linea alba. So again, this is your linea alba where your some of your other muscles of the abdominal wall inserts. Next, we have the nerve supply. So for the nerve supply of our pyramidalis, it's actually supplied by your 12th thoracic nerve, or T12, and it actually includes tensing, or it actually tenses your linea alba. So let's proceed to the functions of our abdominal wall muscles. So we have generally we have three. So we have your oblique muscles. So the oblique muscles laterally flexes and rotates the trunk. Then we have here our rectus abdominis. So it actually flexes the trunk and then stabilizes the pelvis. Okay. Lastly, we have again our pyramidalis, which keeps the linea alba taut during the process. Okay, or during every movement. Okay. So we have here a structure called your rectus sheath. So it is right here. So it is a long fibrous envelope that encloses our rectus abdominis and then the pyramidalis muscle right here. So it is actually formed mainly by the aponeurosis of the three lateral abdominal muscles, which are your first external oblique, internal oblique, and then the transversus abdominis. Here is another image of our rectus sheath. So as you can see here, here is your arcuate line. Take note of this. This is your arcuate line. So it is a horizontal line that demarcates or marks the lower limit of the posterior layer of the rectus sheath. So take note that our rectus sheath has an anterior layer and then the posterior layer. So above the arcuate line, not the acute line, but arcuate line, so it actually looks like this one. Okay. On the other hand, below the arcuate line, it actually looks like this one. Okay. Next, after the anterolateral abdominal wall, let's proceed to the posterior abdominal wall. So it actually is formed by the midline. Sorry, it's actually formed in the midline by the five lumbar vertebrae. So we have your L1, L2, L3, L4, and L5. Aside from that, it is also formed by your 12 ribs. We have the one on the right and then another one on the left. Additionally, we have your upper pelvis that is also formed, or sorry, it also forms the posterior abdominal wall. And then we have the muscles. First, the psoas muscle. So we have here your psoas major and then your psoas minor. Aside from that, we also have the quadratus lumborum right here, and then the aponeurosis of the origin of the transversus abdominis, which is not shown here in the image. And lastly, we have the iliacus muscles. So these iliacus muscles lie in the upper part of your bony pelvis. So right here. As it is actually found in the iliac fossa. So if you can remember in your ANA 1, we have here your iliac fossa. So it is where your iliacus muscle originates. So let's talk about um, the most important muscle, which sometimes it's actually sometimes missed, especially in patients who have low back pain. Okay, let's talk about the quadratus lumborum. So as you can see, it is a flat quadrilateral. So one, two, three, and four shaped muscle that lies alongside the vertebral column. So it's actually um, um, you can actually see it in the image on the slide. So the fibers run up and medially, again upwards and medially, and they are actually inserted into the lower border of the 12th rib. Aside from that, they also insert at the transverse processes of the upper four lumbar vertebrae. So that's L1, L2, L3, and then L4. Okay, so here is a slide with the table. For example, let's focus here on the quadratus lumborum. So all of the muscles are supplied by the lumbar plexus, but the action for your quadratus lumborum is actually it fixes the 12th rib on inspiration. It and then it depresses the 12th rib during forced expiration. Take note of that. And if you laterally flex the vertebral column or your trunk, if you want to reach the your toes from the side when you're standing, the one acting or is active is your quadratus lumborum. Okay. Aside from that, we also have here your psoas muscle. So it originates at the transverse processes, bodies, and intervertebral discs of you start off from the T12 vertebrae and up to the fifth lumbar vertebrae. Now they insert with the iliacus into your lesser trochanter, which is found in your femur, and then it acts as flexor of the thigh or the hip on the trunk. And whenever your thigh is fixed, especially when you are sitting, it actually flexes the trunk on the thigh. So as you can see, for example, as in sitting up from a lying position. Okay, next is your iliacus. So as you can see in the picture earlier, as what we have seen in the picture earlier, it actually originates from the iliac fossa. Now it will insert together with your psoas muscle into your lesser trochanter. Now your iliacus will again flex the thigh on the trunk, and if the thigh is fixed, it flexes the trunk on the thigh. So for example, supine to sit. Okay, So again, your psoas and then iliacus muscle, if they actually flex the thigh and the trunk or form are active during hip flexion, and then if the thigh is fixed during a supine position or lying position, and then when you ask the patient to sit up, it actually activates also your psoas and then your iliacus muscle or your iliopsoas muscle. So when you add your iliacus and the psoas muscle, we call it as your iliopsoas muscle. Next, we have the surface anatomy. So what we're going to talk about are the abdominal quadrants and then the abdominal regions. So for the abdominal quadrants, as the name itself speaks to us, it actually has four divisions. So we have here your right upper quadrant, the left upper quadrant, the right lower quadrant, and then the left lower quadrant. So as you can see, the abdominal wall is divided through the center here, which is your umbilicus. Okay, so this is your umbilicus, and it forms the center of your abdominal quadrant. So we are going to discuss um, the organs after we discuss the abdomen 2. Okay, or at the start of abdomen 2. Next, here is another image of the abdominal quadrants. So here, right here is your epigastrium, which is near your xiphoid process. And then we have your umbilical region. And then we have here your, sorry, for the quadrants, we only have four. So right upper quadrant, left upper quadrant, right lower quadrant, and then the left lower quadrant. On the other hand, we have here the abdominal region. So generally, we have six abdominal regions. We have first, let's start first at the center. So we have the epigastric region. Epi, so above the gastric. Gastric means abdomen. So epigastric region. Next is your umbilical region. So as you can see here, the patient's umbilicus is actually located in that region. And then we have the hypogastric region. Hypo, below, gastric, abdomen. Next, on the right side and on the left side, they have the same names. However, you just indicate if it is right or left. So um, we have your right hypochondriac region, left hypochondriac region, right lumbar region, left lumbar region, and then the one nearest to your inguinal area are your right inguinal region and then the left inguinal region. So these areas are really important, especially when we want to palpate the patient's abdomen to assess if there are um, problems in their internal organs, because sometimes conditions in our or diseases that affect our internal organs, for example, our stomach, our spleen, our gallbladder, and our liver, may present as referred pain. So they may seem like or they may present like a musculoskeletal or pain, for example, in the left shoulder or right shoulder. But if you dig deeper into it, it's actually caused by problems in your internal organs. So these quadrants and regions are important for that specific reason. Okay, so I think this ends our discussion for our abdomen part 1, and I hope you have learned. And please do answer your task sheets and submit them on time. Thank you and God bless.